A renowned bariatric surgeon from Delhi, India, talks about his education and experience. In this video, he explains sleeve gastrectomy, the criteria on which patients are accepted, and the results seen in patients after this surgery.
I've done my graduation and post-graduation in surgery from Postgraduate Institute of Medical Sciences, Robotic, Haryana. And thereafter I did training in minimal access surgery from Sir Gangaram Hospital. That was for a period of 3 years, and subsequently I went in for practice. I have also done subsequent to that fellowship in the Indian Association of Gastrointestinal Endosurgeons, Minimal Access Surgery, International College of Surgeons, and another fellowship. And I have been primarily practicing laparoscopic surgery, advanced laparoscopic surgery, laparoscopic GI surgery, bariatric surgery, and robotic GI surgery. Laparoscopic sleeve gastrectomy is something which is gaining popularity. It is a procedure which is now being used as a single stage procedure. It is something which is extremely popular in India. If we look at the complete scenario of bariatric surgery in our country, we would find that of all the surgeries being done, 60% would be sleeves, 30% would be bypasses, and about 10% would be bands. That's almost in all centers, including ours. Now, a sleeve to start with was a procedure which was used as a first stage for a BPD or any other procedure, and especially in super obese, so that once they scale down to a normal, slightly lower BMI, then we could do a definitive procedure. But over a period of time, it has been seen that they not just help in the patient losing weight, but at the same time they also help in the resolution of metabolic syndromes like diabetes, hypertension, or any other metabolic problems that they have. So as a result, now we are offering sleeve as a single stage procedure. About the choice of the patients who are offered these procedures, we leave it to the patient again. We tell them the merits and demerits of all the three procedures, and then probably decide on what the procedure is, what is the procedure which would be best suited for this particular patient. Our results have been very encouraging. We've been doing sleeves as a single stage procedure for almost more than 4 years now. And the excess weight loss that we've seen in our series had gone up to about 70% initial in the first year, but subsequently it's ranging between 50 to 60% of excess weight loss over a period of 4 years. There has been about 70 to 80% of resolution of diabetes and hypertension in these patients. We primarily don't see any complications associated with sleeve, and the patients can go back, are discharged from the hospital in about 4 to 5 days, and can go back to their own country in about 8 to 10 days time. We have been getting patients from all over the world, and primarily we've been getting patients from a lot of Middle East countries and Africa, but we also get patients from the UK, the US, and since the hospital and the tertiary care center that we have is offering all the best of facilities with a multi-speciality workup for these patients, and having almost all the branches and a very good critical care with a very well balanced and a large ICU that we have. So as a result, these patients are very well, the bariatric patients, especially when we tackle the super obese or with all the metabolic problems, then these patients require a multidisciplinary approach which we can offer to them. And as a result, these patients are very satisfied once they go off from here, and we are able to manage most patients in our
Bariatricsurgeryworld.com is one straight link to affordable weight loss surgery at leading international destinations. Fill out the estimate request form on our site, www.bariatricsurgeryworld.com, for more information. That's www.bariatricsurgeryworld.com. Bariatric Surgery World and its affiliated websites suggest that you always consult a doctor before making a decision regarding any medical trip.